I hear the church bells ringing across the street, so it must be 2 right on the dot. I'll wait for some folks to jump on, and then we'll go ahead and get started just in the interest of time. Okay, so we're at about 100 folks watching right now. So we'll go ahead and get started. Again, after the live, it'll be on our timeline. We'll turn on the closed captioning. And then we are uploading these videos to YouTube as well. And then we do have our frequently asked questions on our website. So just to kind of get started with some status updates, we're still at 18 cases. We are updating case counts every day at 4 p.m. I have not updated this yet, but I will at 4 p.m. But we have 2 people recovered. So we've had lots of questions about recovery, but to be considered recovered, you have to be 7 days out from symptom onset and 3 days, I'm sorry, my hair is in my face here, and 3 days fully recovered from symptoms without the use of fever reducing medication. So you can see how that might take a little while for someone to be deemed recovered, but we have 2 people that are recovered from COVID-19. So that's something to celebrate and give some positive information out there. So that's great news. As you noticed yesterday in the updates, zip code level data is included now in the data that tells you how many cases per zip code in St. Francis County. It's important to understand that some of those zip codes are not just in St. Francis County, they're in other jurisdictions as well. But when I report, I am only reporting for people that reside in St. Francis County. Also, and it's in the post from yesterday, but I want you to know that just because your zip code doesn't have a case doesn't mean that it's safe to forget about social distancing and those hygienic practices. Those things are still of the utmost importance for every single person in Missouri. So we all need to be practicing those social distancing and hygienic practices and gathering restrictions and the recommendations that have been put forth by the CDC and the Coronavirus Task Force. I wanted to kind of point out a couple things because I know we keep getting questions about, how many people are pending, how many people have been tested, that type of thing. And I spoke a little bit in our prior videos about how we know if someone's been tested, because we don't always know exactly the number of people who have been tested or who are pending, because it's not required by law for doctors to report that to us. So that we know of, at least 89 people have been tested to date in St. Francis County. So that's our residents, St. Francis County residents. 24 of those are pending right now. So we're waiting on results from them. And again, 18 are positive, and then you can kind of do the math from there for the ones that have been negative. So we're still waiting on 24 as it stands right now, and we'll continue to get more and more pending as people are tested. So that was a question that we got, and I've heard a lot about folks having trouble getting tested. Most of our healthcare providers are providing this test right now. So it's something you have to reach out to your healthcare provider, and then they do a triage, ask you some questions, and then decide whether or not you would be appropriate for testing. So that's something that is approved through the healthcare provider. If they want to send that test through State Public Health Lab, then the state has to approve that test. But a lot of private labs are testing right now. We've spoken about grocery stores and things with, these stay-at-home orders, and we're encouraging people to use, curbside, pickup if you can, and then delivery. Some of our grocery stores do delivery. And so I got some questions on that as to who does that. Those are things that you would need to check with those grocery stores on. I can say I know that Walmart does the pickup. That's the one I use. I'm not endorsing them. I just know that they do that. And so I have to use an app to do that on my phone. But does Schnucks do that as well?
I think they do delivery.
Yeah. I have a helper over here.
Delivery as well.
Okay. I have a helper over here. She's 6 foot from me, so no worries. But yeah, so Walmart does some delivery, and then Schnucks as well. And I've heard that Aldi's does that. I'm not sure about that, but you would need to check with those grocery stores. If anything, I would say if you're not able to do those pickups or deliveries, at least try to strategize when you go to the grocery stores. And try to get as much as you can when you go, so that you're not having to go every day. I know that sometimes that's difficult depending on financial ability and that type of thing, but that would be my suggestion. If you can't utilize those types of resources, that you try to strategize a little bit in grocery shopping, so that you're not in there as much. Cloth coverings for your face. So I talked a little bit about this yesterday with local media, but as probably a lot of you know, the CDC is suggesting that everyone wear cloth coverings in public spaces, especially in places that you cannot, it's difficult to maintain social distancing. So that's places like the grocery store. So a cloth covering is not necessarily a surgical mask. That could be a bandana, a scarf. We really need to reserve surgical masks and N95s for healthcare providers. So that is something that they're recommending, that if you're going out into a public space, that you utilize a cloth covering over your face, because there's growing evidence to show that people who are asymptomatic but are infected, can transmit this disease without being symptomatic. I also got a question submitted prior on when will the virus peak in Missouri. I know that the St. Louis Coronavirus Task Force has said, 2 to 3 weeks from now is when they're expecting that to happen in Missouri. And most of the models that I have seen, there's a few out there, and they use some different data to decide what they're putting forth as their projection. But it looks like mid to late April, probably more in the latter half of April, and then possibly into May. Again, that depends on what model you're showing. Now, usually in the rural area, that we might be a little bit behind from St. Louis, but then keep in mind too that we have a lot of people that travel to those areas that are being heavily affected at this time to the St. Louis area. So that's important to keep in mind as well. Okay, so I'm going to scroll back through some of these comments. It looks like we still have, 10 minutes. So scroll back through and see if there's some comments and questions in addition to those. I see some thank yous. You're welcome. Are there some tests that you can get results back in 24 hours here or anywhere? That is a question for your doctor's office. I know there are some rapid tests. I don't know of any of our doctors locally that have gotten the rapid test. I've seen things about rapid tests being ones that can result in as little as 10 minutes and then 40 minutes. So I know that there were some local doctors trying to get the rapid test, but I don't know of any that have actually received that. But you would have to discuss with your doctor, what lab they use and what they're seeing. Right now, for private labs, we're seeing usually around 3 days to get those resulted. But it really just depends on where that lab's going to, who is transporting that lab. For state public health lab, it has to do with priority level. So it's dependent on a couple of different things. Do we know if local schools will go back to school this year? That's hard to say. I've seen projections, but as of right now, schools closed until at least the 30th, I believe, is what our local schools have put out. 24th is what the governor's order says. So I think that's hard to say just yet. I see some questions about medical supplies. Those things are something that if it's a local company, they go through what's called a healthcare coalition, or there's some other supply companies that they can use. If people have questions about that, we can point them in the right direction. So you can call us and we can send you some information. But the health center is not allowed actually to order on behalf of any other entities. I see a question about increases in cases confirmed today. We have had no additional cases confirmed today as of right now. That could change, but we'll update case counts at 4 p.m. I wanted to touch a little bit on the stay-at-home order as well. That was something that was on my list that I had kind of skipped over for just a second. But so there's a couple things. So Missouri has a statewide order in place now. St. Francis County still has their order in place. Though the links to all of those are on our website under COVID updates, and I would encourage you to go read those because we've had a lot of questions about those orders. So in the Missouri guidance, it says non-essential businesses can still operate if they are able to follow all of the social distancing requirements and hygienic practices. So that means that if they can do those things under the Missouri statewide order, they are allowed to operate. In our order, under Article 4, there is an order for St. Francis County for innovation for local businesses. And that, again, is really very similar to that guidance for the Missouri statewide order in allowing folks to stay open if they're able to, meet the social distancing requirements. So 6 foot away from other people, anybody in their establishment would have to meet that requirement at all times. Have appropriate hygienic practices such as hand washing, sanitation, that type of thing. And then their gathering limits of 10 or less, and that includes employees. So I think that's important to note that those things are included in those orders, and we've received some reports on some local businesses, and we are working on those things. There's a list of disinfection. I see a question about how to disinfect. There's a list of those things on the CDC's website, and I'll add that to our frequently asked questions to have in there. I can't talk about personal information about our cases because we can't identify those people. But what I would ask is that we respect that, and prayers and thoughts for our folks that are experiencing this disease. Again, I see some questions about the stay-at-home order. I would ask that you go and read those on our website and read the guidance for those. And if you have further questions, please reach out to us. What can you do when your neighbor is having people over in and out all day? That's something that you can reach out to us, and if it's something that we need to follow up on, we need contact information for those people, and we can reach out and kind of figure out what's the situation and how we can address that and give them some education, that type of thing. Just looking at my clock here. I want to donate blood. Any local drives coming up? Not that I know of, but I know that's been a question. Not that I know of, but you want to check on the Red Cross website to see if there's local donations that are coming up. Just trying to scroll. I have the video of slot machines in my store. I have closed them down due to them being close together and people want to stand around them. Did I do the right thing? I probably need some more information about that. So if you have a question, you can submit that on our website or give us a call. But I think I need some more information to answer that. I see another question about recovery. I spoke about that earlier in the video. We're going to update those numbers later today, but 2 people have recovered, so that's really great news. Is there a test that will show someone has had the virus but is now over it? Also, how much immunity can be gained from having the virus and surviving? So your second question, I have an answer to on our frequently asked questions. There's basically not an answer yet to know how long your immunity lasts after recovering from this illness. The first question has to do with antibodies. And there is a test out there. I've seen some information on it. It's not a test that's being used locally, but there is a test out there, and those are similar tests. Sorry. They're paging.
Quest Diagnostics.
So.
A nurse, please pick up part
Sorry.
601.
We're working here, so so there is a test that they're working on and that I've read about. That's a similar test to other things that we test for that test for antibodies. A Hep A test can test to see if somebody's either had the vaccine or was exposed and now has immunity, and can test to see if they have an active infection or a new infection. So I have read about that. Okay, I'm running out of time here. I see some kind of repeat questions, but it's at the beginning, so I'd ask you to kind of go back and take a look at that. How long does it take to recover? So again, official recovery time, the lighting has changed in here severely for the natural light, like it went down, so I look very fluorescent. Okay, so it depends. I mean, so you may be feeling better. However, the CDC has criteria that says whether someone is recovered or not. And that criteria is they have to be 7 days out from symptom onset and 3 days of symptom recovery without the use of fever-reducing medication. So it's quite the process to be officially recovered. So. Is it possible for your department to order hand sanitizer wholesale and then purchase it for the public and to purchase it from you? We are not a medical supplier. That's not something that we do. So I would say at this time, no. The CDC has said, good old-fashioned hand washing for 20 seconds with soap and water works for this, but we've also had trouble getting hand sanitizer. We have not been able to secure any more than what we already have on stock for our clients and staff. Okay, I'm going to try to find one more question that I haven't already answered, and then I'm going to have to hop off here. Please stress wearing masks. I talked about that earlier, but if you're going out into the community, you need to cover your face based on CDC guidance. Again, that's not necessarily with a surgical mask, but a bandana, a covering with a scarf, that type of thing. I'm sorry, these questions are popping up. Is the flu still going around also? So this is the last question I'll take, and then we'll go back through and try to put these questions that maybe we weren't able to answer. It looks like most of them are kind of done, but we'll put those on our frequently asked questions on our website. But so the flu, we are still getting cases reported. We'll get those reported. We get flu reported all year round, mostly between the months of October and May, but it has drastically reduced. I think we can probably make some educated assumptions based on the fact that a lot of people are kind of, if they don't need to access healthcare right now, a lot of people are not because of the concern of COVID-19. So we are still seeing flu cases reported, and I'll put that up to about where we're at and how many we've gotten this week. But not near as much as what we had been getting. We've had more than 1,300 cases of flu, but that's still certainly a concern and something that we continue to investigate and keep track of. Okay, that's really all I have for you at this time. Again, I just want to really encourage you to stay home if at all possible. The orders are out there on our website for both Missouri and the St. Francis County order, along with guidance for both of those orders. And so if you have questions or concerns, I would ask that you reach out to us via our website on the Contact Us tab. Or give us a call here. Our environmental health department is answering lots of questions for the public, and our nurses are doing investigation all day, every day. And then I would also ask that if you have a medical concern, please do not reach out to the health center for emergency care. We don't do acute care. We refer back to people's physicians, but I've had some messages that have come through our Facebook at midnight, messages messages that have been left on our answering machine at 10 o'clock at night, saying that somebody has shortness of breath. Please call 911 if you have shortness of breath and let them know the symptoms that you're having. Don't wait for an answer from the health center at those times, because again, we are not emergency medical care, and we want you to get the care that you need. So again, please reach out to us via our phone, 573-431-1947, or you can submit a question on the Contact Us tab. I will see you again on Thursday at 2 p.m. Thanks.